A great pleasure to welcome Aliyah Allie, who's the executive head at X Bigley Labs by Dis-Chem. Aliyah, greetings to you and welcome. Thank you for joining us. Now, listen, I discovered the Bigley Labs and I discovered you on your fantastic LinkedIn postings that you make. But for those who don't know what X is and what Bigley Labs, I'm very aware of Dis-Chem as I'm a customer, but what is X and Bigley Labs all about?
Aki, thank you so much for having us, and thank you for being a loyal Dis-Chem customer. There's really nowhere else to go. I'm not surprised that you hadn't heard of us. We are very newly established. We call ourselves Dis-Chem's Innovation Hub. There are moments where I feel like we're Dis-Chem's ICU, but really our job is to help Dis-Chem on this journey of moving from being the pharmacy retailer that everyone knows and loves to being a fundamental player in South Africa that solves a healthcare crisis that we all know and experience, or many parts of the population know and experience. So our team focuses on taking the core assets that are critical for the strategy to unlock, that have historically been underinvested in, but need to be fixed really quickly with a great deal of skill and competence. Things like data and analytics, things like digital, very significant chunks of the marketing function that require technology. Our job is also to really help Dis-Chem accelerate in being a more modern organization in how our employees experience the organization. So a lot of kind of process engineering, automation, helping Dis-Chem employees find real delight in doing their work so that they're doing the things that only humans can do and not the annoying, repetitive things that technology can take care of easily.
Okay, wow, that is very cool. It sounds like an amazing place to work because I guess it's exciting because you get to try new things and you get to set the agenda for many things and experimentation. So it's like a giant sandbox that you get to play with some really cool toys and ideas, which is fantastic. My kind of place, by the way. So when we talk about innovation, and something I'm very passionate about is healthcare, and we're just seeing tremendous strides being made in healthcare. How is innovation improving access to healthcare?
Yeah, I mean, firstly, Aki, you should come and play. You should definitely come and play in our sandbox if it's where you like to work. I joined on the 1st of December 2024, and I have consistently said since then that I have the best job in the country. And I think many of my colleagues who work in this team share that sentiment. Um, I think innovation is such an interesting idea because it means many different things to different people. And the sentiment of innovation, which is around driving newness into solving old and difficult problems, is a thing that interestingly has been around since the start of time, effectively. Humans have been innovating to solve problems in interesting ways. I think in our moment, innovation really means, for me, two very important things. The one is, how do you really center the end user? For a long time, the solving of problems, particularly in corporate environments, in businesses in South Africa, has been a group of senior, smart people sitting together and imagining themselves as the customer and solving that way. In our world, innovation means really solving for the customer, and you can only solve for the customer when you really understand the customer intimately. And that sounds obvious, but in many businesses in South Africa is a very novel idea and something actually very difficult to achieve. The second is technology. And I mean, if I have an incredible piece of artwork outside my office that plots the evolution of technology over millennia. And there is absolutely no doubt, like, to see it visually is quite an incredible thing, but there can be absolutely no doubt that we're in a moment where technology is evolving and advancing at a rate that has historically never happened before. So the ability to understand that evolution of technology and then stay on the cutting edge of it, while understanding that many businesses in South Africa, Dis-Chem included, are sitting often on tech stacks that are very old, and being able to drive what the customer wants with the cutting edge of technology, despite the clunkiness that is available to you, that is really the heart of innovation. Now, many industries have done this, right? Many industries have done the work of figuring out how do you take this newness and take what's available to you to solve age-old problems. In healthcare, that evolution is very interesting because it's actually truly one of the most intimate things to you as an individual, as a human, and can, if used badly, feel very impersonal. I spent some time in my life living in the US, and the US at that stage for me was a market I'd been in that had the adoption of technology substantially more mature than anywhere else I'd lived in. But my experience of healthcare was a doctor sitting with a screen that was connected to the wall, looking at the screen, asking me a series of questions, completely disconnected to me. I felt like I wasn't being listened to, and for something that is so deeply personal, really requires an intimacy of a relationship with someone who you experience as the expert. So there's some part of that which is like, how do you use technology to make the thing feel what it's supposed to feel like for the end user, which is deeply personal. And then how do you make use of data in a way that is sophisticated, that is really, really on the cutting edge of what a human as an individual needs? And we currently sit with many different technologies available to us, but no one is pulling that together and helping you move your health forward in the way that is most appropriate for you.
Wow, what a lovely description. And it's so true. Hey, when you look at healthcare, even the digitization of healthcare, where you can access doctors, remotely, for example, it's still very impersonal, right? And there's, technology, as wonderful as it is, lacks the empathy of a human feel. And I guess that's what we're going to change. But you're quite right. The evolution of technology has certainly been very extraordinary. When you look at today, anybody with a smartphone has access to incredible amounts of information and, PhD like information at the touch of your fingertips. And I guess that why I'm saying that and why I'm using the smartphone, despite the fact that, smartphone adoption has grown tremendously and access to technology has grown, but there is still the reality that many people don't have the same access. So what would you say is the biggest structural barrier that's still preventing millions of South Africans to accessing really good quality healthcare? And which of these which of these innovations is really best positioned to solve this challenge today?
Yeah, it actually is incredibly heartbreaking for me just how many South Africans don't have access to what is available internationally, right? Like we have some really sophisticated solutions available to us. And many South Africans are still waking up at 4 a.m. and sitting at a clinic. And the truth is, the public system is actually exceptional in South Africa, right? Like we have some of the world's smartest, most capable practitioners working in the public sector. If you have any tertiary need, like you need to be admitted to a hospital and you need cancer care or dialysis, the public system is actually like really, really great quality in terms of the sophistication of the practitioners that work there. But the experience is just so terrible. And the experience seems to ignore the fact that these millions of South Africans that have to access healthcare in that system have jobs often or are unemployed and need to be in the active parts of the day out in the world trying to find employment. Um, and I think part of the like structural barrier here is where in the chain the solving of the biggest problems are happening. So you have a government that really is trying its best, right? To say that the people in the public sector are not doing impeccable work would be a massive lie and a huge disservice to the people who've dedicated their lives to trying to get access and good quality healthcare to people. I know many people who work in the public sector who are incredibly selfless and smart and capable. The challenge is that the government is big and cumbersome and has so many competing priorities. So we've left it in the hands of the government to solve this incredibly important problem, but the government on its own can't. Now, in the private sector, what you have is insurance players who really have been limited by regulation, and the limits of regulation has stopped them from really building products that make it possible for the average South African to de-risk their lives and access a medical aid product, right? So medical aids, but structurally have to be expensive for medical aids to be able to afford to do it with some level of profitability. Um, And then you have these health techs that are super, super innovative and enthusiastic about using technology to solve this problem. The challenge is that they don't have the wallet, the capital wallet, the investment wallet to be able to really tackle this problem. So you have all these players of different sizes that have inherently in them challenges, and that is where Dis-Chem comes in. We are a business that has 40 years of a brand that is deeply trusted by South Africans, with a very significant portion of your healthcare, right? Like primarily your interface with a nurse or your interface with a pharmacist. We are the right size to be able to move and massively make a difference, right? We have 300 stores in our network. So we have the right level of scale, and we have an investment envelope to be able to plug in and try to solve this problem. Now, what that requires is for Dis-Chem to be on this journey that evolves from being the pharmacy retailer that everyone knows and loves to a business that is able to build insurance funding products that are innovative and gives access to South Africans that allows them to de-risk their lives. We then, have this network of nurses, and we know that nurse-led model is incredibly effective for primary healthcare. But it's also significantly cheaper than plugging in a big network of GPs. So we have this curated network of providers that makes the insurance business work really well. And then we, of course, have this retail and pharmacy muscle that gives us the scale, and a brand that is very trusted as a health authority in South Africa. So, yeah, I mean, structurally, we are in a challenging moment where millions of South Africans don't have access, but Dis-Chem is really uniquely positioned to be able to tackle this problem head on, and have actually over the past 5 years been doing it already.
Yeah, and of course, you've got the scale and you've got the broad network that covers many parts of the country. And you already have that existing data that you know what consumers are, what's their health like, just based on what they're buying. I mean, that data is quite significant. So your brand says better health starts here, and that's your brand promise at Dis-Chem. What is ex Bigly Labs doing right now to make healthcare more affordable, more accessible, and really seamless for South Africans? Because you've highlighted the barriers that exist there. What are you guys at X Labs doing to make it, easier for us at Bigly Labs?
Yeah, so I guess the first thing is really to the point that you made, which is like the data, right? People often think businesses take in huge amounts of data, and that data is ready and available to just use and help customers. Because data isn't just about knowing what people are doing. It's about knowing what people are doing so that you can help them do the next appropriate thing for them. So if someone's coming in and buying an antibiotic, to offer them a probiotic because that's the appropriate helpful thing for them. But getting data right to be able to do that is actually an incredibly challenging thing. So one of the first things our team's tackling is really like within the Dis-Chem world, finding the right data, integrating, connecting the right data so that we're able to help customers move them along the right journeys, right? So that's one of the critical things that the team is doing. The second thing that the team is doing is South Africans are more and more deliberately digitally active and digitally conscious, right? And we're finding that across the board. Often people feel like, oh, certain sectors of the population aren't enthusiastic about being digitally engaged. It's just not true. When we look at how customers are engaging, we're finding across age groups, across demographics, across socioeconomic status, people are enthusiastic about being digitally engaged. They want to be able to do things on their phone. And there are a couple of real leading players in South Africa that have helped drive this evolution, right? Capitec is a critical example of this. Like the Capitec base, regardless of how old you are primarily banking on their app. My grandmother, who's in her 80s, often needs help. Someone needs to co-pilot with her, but she's primarily banking on the app. Checkers, Shoprite has done a marvelous job of driving digital adoption, particularly in e-commerce, into the South African population. So one of the things we have to do within Dis-Chem is really massively mature our digital asset. And then kind of a third bucket of things that the team works on is we are obsessed with frictions. I'm sure, Aki, you're a similar personality to me in that you were probably the person who found things in your life that really, really irritated you and then had no choice but to fix it. we are a group of those people here at Bigley. So we are like little swarms of bees that like go into the Dis-Chem world, and we find the things that are irritating and not working, and we obsess over fixing them. One of the things we're fixing at the moment, to give you an example, is we obviously have this insurance business. And when you participate in the insurance business, and you have cover, you get a cover boost in our loyalty program. So the way our loyalty program works is, for belonging, you get a 10% discount. Once you've touched your pharmacy, that discount goes up by 5%. When you are a Capitec customer and you bank with Capitec and you come into our system and you pay with your Capitec card, you get an extra 5%. So you have this 20% available to you. Now, that base discount of 10% increases once you have an insurance product with us. That increase is a function of how much you're spending on your insurance every month with Dis-Chem and what your health level is. So you can have health level 1 to health level 5 as a function of a check that you've come to do with us. And we're finding that customers don't quite understand how that works. They don't understand how the check works. They don't understand how that increases their health level and what the potential is to increase their health level, and the relationship between their health level and their discount in our environment. That is like an insane thing for a customer to struggle with. So one of the things the team's obsessed with at the moment is helping make very easy and clear to a customer how they move through our system, increasing their discount. So those little frictions all over the place, the team collects and then obsess over and fix them.
Wow, fascinating. Really, absolutely fascinating how you guys are working. And of course, the data is so important. And it's so true, you know. I mean, I look at my folks as well, you know, they're active on the digital platforms, and, you know, people are accessing those apps. And I guess for me, I'd love to see many apps do more than just telling me how many points I've got on my rewards program. So, and I think that's part of the evolution. And you recently launched the Better Awards. You just spoke about it now, this partnership between yourselves and Capitec that intentionally aims to redefine customer value. So can you unpack the role partnerships between startups, government, and the private sector really play in scaling healthcare innovation beyond pilots into real everyday impact? And if we don't have those partnerships, I don't think we can progress. So these partnerships are key.
Absolutely. I couldn't agree more. You know, we find you could go it alone. You could definitely, and Dis-Chem could be a business that goes it alone, right? Because we have an incredibly successful business. We have lots of very smart people who are doing exceptional work, but it doesn't make any sense. For us, the purpose of Better Rewards in particular, and then the purpose of our business, is to drive the Better Health Starts Here promise. And part of driving that Better Health Starts Here promise in a country where we know folks are deeply, deeply constrained economically. We have a high level of unemployment. We have low savings rate. Like, we know that people are economically constrained. And the South African shopper for a very long time has primarily on average been a very value constrained shopper. So the idea of giving back value to the consumer so they're able to access the basic things that they need, for us, particularly in the healthcare space, is fundamental. It is existential for us as a business. So building these partnerships across the board only amplifies our ability to deliver on that promise to the customer, right? So the Capitec customer, the average Capitec customer, is a customer who is accessing their healthcare at the moment in the public sector. Why not help that Capitec customer come into the Dis-Chem environment to be able to, at the right levels of affordability, access healthcare at significantly better and experience at significantly higher quality? So instead of sitting at the clinic the entire day, come into our system and get your vaccinations. And that vaccination point is actually tethered to another partnership, which you're asking about, which is the government, right? We have an incredible public-private partnership in many provinces where the government effectively gives us the stock. We vaccinate people, and all we do is charge them a service fee, right, for the nurse's time. Instead of spending the entire day sitting at the clinic, bring your kid into a Dis-Chem and we will vaccinate. And we're solving not just that individual customer's problem, but we're solving the government's problem. The more capacity they're able to build in their clinics, in the hospitals, and channel people into our environment, the more capable they are of solving the real tricky healthcare issues that are things beyond vaccinations, right? So it really is in the true spirit of Ubuntu, and I feel very silly saying it, but in the true spirit of Ubuntu, we're really in it together. And it's in this being together, building the right partnerships to deliver the right things, puts the customer customer at the center helps solve real critical social problems in our country.
Yeah. And you talk about data, we've spoken about AI as well. How can and data and AI and these digital health platforms that we talk about be used responsibly to improve outcomes without widening existing inequalities? Because we know that digital divide, and it's a very sensitive issue, right? How do we go around this?
I guess there are two things in response to your question. The one is, I spend a fair amount of my time with CIOs and other tech leaders in the country, and I have to tell you, we're all tackling this AI beast in a way that tries to drive progress, right? But no one has it figured out yet. It's very, I mean, it's old technology, but it's democratization in the way that we have it available to everyone now is new. And we're all trying to grapple with figuring out how we make best use of the power that is the machine of AI. And we're certainly making strides within the Dis-Chem world, but we're nowhere near landed. I think the second thing is this question of widening inequalities, and I think it's absolutely critical that leaders in South Africa constantly push ourselves to think through how we not just solve for the top 5% in our population, that we're constantly solving for driving the value that our businesses create, especially businesses as big as Dis-Chem, and we make that truly available in a real accessible way. And I'll give you a very tactical example. Um, in the evolution of our loyalty program, we obviously have this health check as a core part of of the expanding of your discount, right? And it's through that health check that we're able to really drive you on a journey to improve your health. We have lots of wearables available. I wear something called a Whoop, which is actually like a reasonably expensive piece of technology. And we also, many South Africans wear Apple Watches or they wear Garmin that gives you great data, and they're very expensive wearables. But there's a very small sliver of the population that can afford those. Part of what we're doing at the moment is working with we're actually working with two different channels of providers. The one is a channel of provider that allows us to find wearables that are significantly cheaper. It's exceptional technology baked inside them, but they're as low as kind of $10 to $15, right? Which is far more possible for someone to engage with than an Apple Watch. The other piece is that there are some technology players, or there's one in particularly that we have identified, that takes data from any wearable, regardless of how expensive they are, and takes the data that comes from them and pulls them into an interface that is as sophisticated as what a Whoop would be, or what an Apple Watch would be. So you only find those things when you're actively looking to find them, right? Like if you're a business that is quite satisfied with serving 5% of the population that can afford an Apple Watch, you get an Apple Watch to them and that's the end of it. You're not going to get anywhere. But within our team and within the broader Dis-Chem world, we're constantly asking the question around, are we driving a further divide between rich and poor? And are we isolating and alienating the exact customer we should be solving for? And if the answer to that question is yes, then we know that we have more work to do to push the thinking even further to drive accessibility, which is why we're able to find the right wearable that is at the right quality at the lowest cost. And a wearable is just one example. There are thousands of those that we're tackling every day.
Yeah, and absolutely. And as you correctly say, as technology becomes democratized, the costs drop down, and the price of sensors that are in these smartwatches has dropped exponentially over the last few years. So it's really possible now to get to that price point where you've got an affordable smartwatch that's able to give you enough data to give you a good idea on what your health is like. And I guess consumers now expect healthcare to feel like banking because it's all digital, and there's various digital avenues to this, which I include e-commerce, by the way, that instant personalized digital first experience. How is X and Bigly Labs bringing customer-centric experiences into healthcare without compromising clinical safety and trust? Because at the end of the day, I think that if there's one thing that people take seriously, and there's one thing that you need to build trust in, and that's healthcare. You don't want to take any risks to your health. So how do you get people to trust you? and be safe.
Yeah, I mean the team obsesses over this, right? Like ensuring that because the bar for us isn't just as a retailer, it isn't even as a pharmacist. You're right. The bar for us is as a health player. We take in very sensitive consumer data, and we're only going to take more and more sensitive health data into our system as we help customers move along their healthcare journeys. Um, there's a group of very, very smart people who obsess over keeping data secure in our environment. And we're not perfect, and no one is, right? Like every single player, some of the most sophisticated tech players in the world have had breaches. We certainly have had you know, our challenges in this space. But yeah, like the team absolutely obsesses over this, and we invest very heavily in making sure that we're a secure environment. Um, Driving the right digital experiences, like absolutely a thing that the team obsesses over as well, right? We certainly, when I took the job, anytime someone found out that I work for Dis-Chem, one of the first things they told me is your app sucks. And I'm like, we know. So we're rebuilding it from scratch. And the rebuilding from scratch isn't just to drive better experiences, it's also to do what you're describing, which is help us lift the bar significantly on keeping data safe.
Okay. All right. So that's fantastic. So I'm glad you take my data and my information seriously, because I do trust you, and I do trust Dis-Chem in in keeping my healthcare and my prescriptions and all that kind of stuff safe, which is a great first step. And as you say, I mean, that digital trust echoes in every single organization around the world. I think it's the one thing in every organization that's the biggest risk today, and that is any kind of breach. And it's great to hear that you are taking it very, very seriously. When you look ahead, and I know it's difficult to look ahead, Aliyah, because 3 to 5 years from now, it's impossible to say what's going to happen. I mean, if you look at the AI world, we're likely to hit AGI, and that's going to be a different game changer for all of us. But what do you think is going to be the next big shift in South African healthcare? And, what will be the role of players and retailers like Dis-Chem play in the future? You've certainly highlighted that your pathway is on a digital pathway. You are still a retailer, but healthcare is at your core. So what's your future like at Dis-Chem?
Yeah, I mean, I think this transition from just a pharmacy retailer to a true integrated health player is certainly on the horizon for us. We're actively delivering on that strategy at the moment. Um, yeah, it's difficult to answer that question looking kind of navel gazing and looking inward. I, when I think about the future, think about what's happening in healthcare globally, right? People are more and more shifting away from just a disease orientation to their health to one that really is proactive and preventative. And I think that's where, so Dis-Chem certainly has a role to play when it comes to disease management, and we do, right? We are where you can get your medication. We are where you can get all the ancillary things to get your medication. We are where you come when you're not feeling well, when your child's not feeling well, or your parents are not feeling well. And we will always have an important role to play. But more and more, we are the place where you come to trust to get your advice and get the things that you need to be able to manage your health preemptively ahead of disease. Um, so come into the Dis-Chem system and do a check, and let us give you a sense of holistically where you are. And then let us help you on a journey to more and more manage your health so that your health is around avoiding disease and in the direction of living longer. We know that people are living longer. Every year, the crop of people who are born have a life expectancy that is a little bit longer than the crop of people that were born the previous year. But we are at risk of having those people who are living longer be really ill in their aged years. And we have a deep responsibility of ensuring that people live not just longer, but well for substantially longer. And that's a little bit what globally we see that's the trend. People care about their health in that way. And they need a partner to be able to do that with, that is able to give them the right advice and the quality of product and good and medication that they trust immediately, and one that can really only be delivered by an authority, which is what Dis-Chem is.
Fantastic. I've absolutely enjoyed talking to Aliyah Allie executive head at X for Bigley Labs by Dis-Chem. I look forward to come and playing at your laboratory and seeing what you guys are doing in the background. It sounds absolutely fascinating. And as a Dis-Chem customer, I look forward to seeing the enhancements to the app and all the stuff we've been talking about over the next couple of years. And I hope to catch up with you real soon. Aliyah, thank you very much for your time.
You're welcome. You're welcome anytime. We have very good coffee, I promise.